Hi, everyone. Ron Crider here. Today is March the 24th, 2020. It's Tuesday. This is my update. I hope you like the new plan. I keep coming up with a new plan every day for these numbers, but I think you're going to like the new numbers plan. We're going to insert the numbers here now. I pre-recorded it so I could show it to you. It's pretty nice, and you will see our beach here in Vero Beach at the Victoria Condominium. And I put all the numbers on top of that, and I plan to do that just about every day. So here are the numbers for today, and then I'll get back to the news for today. Okay, I think I've come up with a system where everybody can see this on your phones, your tablets, and your computers. These are the numbers for COVID-19 increases over yesterday. Today is March the 24th. It's Tuesday. Dade County has 60 more since yesterday of cases. Broward County had 48 more over yesterday. Palm Beach County had 12 over yesterday. Martin County didn't add any new ones. St. Lucie County added 3. Indian River County added 1. Brevard County added 2. And Orange County, that would be Orlando, added 2. Total global cases, 42,777. Total deaths over yesterday, 2,203. That's globally, all over the world. That's additional deaths. U.S. cases, 10,451 over yesterday. U.S. deaths, 117 over yesterday. Florida deaths yesterday, 0. Total deaths in the state of Florida were 18. So those are the numbers, and that's what we're going to stick with from now on. I think this makes it pretty easy for everybody to see. I hope you like this look. Okay, now here's the news for today, Tuesday, March the 24th, and there's plenty of things to talk about. So let's talk about this. The cure cannot be worse than the problem, says the president. No question about that, always. However, in this case, the problem has to be fixed. So the president's goal was to get our country back to work by Easter. That's 19 days from today. That would be April the 12th. 90% of all the tests in the United States tested negative. So far, testing in the United States has exceeded that of South Korea. And my source is, of course, this president's town hall meeting today. Well, there's a lot of controversy whether he can actually do that or not. We'll have to see. It seems pretty ambitious to me. I understand what he's trying to do, but we don't want to do it at the risk of having all kinds of problems and going back to be in a worse shape than we are right now. Hey, let's face it, I'm a real Trump guy, as you probably know. But I do kind of question his wisdom on this. I know that it's important to get the economy going again, and we just can't sit around and do nothing. On the other hand, we don't want to make it worse than it already is. So we're just going to have to wait and see. I'm not going to be the Monday morning quarterback or the armchair executive here trying to figure out what the president's up to. He's got a lot smarter people around him than I certainly do. So let's just take a look at it. But it does seem a little bit ambitious to me. Okay, now as New York City and the surrounding area has become the epicenter for COVID-19 pandemic here in America, Governor Ron DeSantis said on Monday he is ordering anyone arriving on flights from New York and the New York region to be self-quarantined for at least 2 weeks. Sounds like a good idea to me because, boy, today we had something like 10,000 new cases up there in New York City. Okay, a new study was done by the Center for Disease Control and Prevention, noted that COVID-19 lived up to 17 days on the Diamond Princess cruise ship, significantly longer than previous studies had suggested. So, yeah, all of a sudden, we think we get this place all cleaned up after a couple of days or maybe a week, and here it is. They were telling us for a while that this virus only lasted for like 4 or 5 days on stainless steel. Now they're saying it could be up to 17 days. Jury's still out on that. They're still working on it, but it's something we have to consider. You keep hearing all these things, and every day it changes. That's why I do this. The final hour of trading today, gains picked up steam, giving the Dow Jones Industrial Average 2,112-point gain, the biggest ever, or an 11% gain, while the S&P 500 gained 9.3, and the NASDAQ over 8.1%. It's not time to drink the champagne. It's not time to celebrate. Yes, it's good that it went up. They're beginning to hear some good news. You heard me say yesterday, the market's still in quicksand. It doesn't really have a good footing. And until it gets a good financial footing, what do you expect? I mean, it makes perfect sense to me. So we got to be very, very careful about where we go with this. Of course, it's a terrific time to be buying while the market is down in the 20,000 area, for heaven's sakes, because we've been as high as 29,000. So, a great buying experience. And it will come back. There's no question about it. If you have a lot of money, be buying right now. But a lot of people are sitting on the sidelines just waiting to see what's going to happen. I did another video today. You'll be able to find it under an area. Do you think you have COVID-19? It's a little short video, and it shows you the Indian River Hospital. But if you think you may have it, just thought I'd throw that in. Start by calling the Cleveland Clinic here in Vero Beach at the Indian River Hospital. Their phone number is 772-226-4846. Now, here's an important thing. This is really important. An appointment from the Cleveland Clinic here in Florida is required for COVID-19 testing. Only patients with an appointment will be seen at the drive-through testing center. Now, on that video that we did earlier today, you'll be able to see the actual testing center. You'll be able to see exactly how it looks, and they have a quarantine tent. So if you come in there and they find out that you test positive, bang, you're going into the quarantine tent, and they'll take care of you. If you're in Martin County, call this number, 772-419-3360. They'll take care of you there. The global spread of COVID-19 has forced the Tokyo Olympics to be postponed until next summer at the latest. Well, I already told you that yesterday, but it is official now. Okay, the private sector is getting involved in the COVID-19 outbreak. Ford Motor Company executive Bill Ford said on Tuesday that the automobile company is working with General Electric and 3M to gear up production on essential medical equipment. This is not good news. A midshipman at the United States Naval Academy in Annapolis, Maryland, has tested positive for COVID-19 and is currently self-quarantined at his home. So I don't know where this is going, but U.S. major airlines are drafting a plan for a potential voluntary shutdown of virtually all passenger flights across the United States. According to industry and federal officials, as the government agencies also considered ordering such a move, and the National Air Traffic Control System continues to be ravaged by COVID-19 problems as well. I don't know if the president's going to go along with that. He wants to get everybody back to work and not slow things down. The World Health Organization says the pandemic is accelerating. We need to attack the virus with an aggressive and targeted tactic. That's what WHO says. U.S. Surgeon General warned Monday that the pandemic is nowhere close to being over. So there you go. President wants to get it over. By Easter, he wants us to be moving ahead. And you got the World Health Organization and the Surgeon General telling us it's nowhere close to being over. All right. I promise I'm not going to be too political, but this is something that you do need to know because I didn't know this myself. I'll tell you why in a minute. The Biden election team has repeatedly argued that the president once referred to COVID-19 as a hoax. The claim has been refuted by numerous fact checkers, including the Washington Post, the liberal Washington Post, which found that Trump was clearly referring to Democrats' effort to blame him for the pandemic and not the virus itself. So, I mean, quite frankly, I could probably hear him saying that at one point early on, but he didn't say it. So he gets blamed for a lot of stuff, and some of the stuff he gets blamed for, he should be blamed for. We keep trying to figure out how to get his tweeter away from him, but that's not working very well. So he did not say that this pandemic, this COVID-19 is a hoax. He never said that. And the Washington Post said, hey, if the Washington Post said that he didn't say it, it has to be true. The Washington Post only lies every once in a while. On Monday, Fiat began converting one of its car plants in China to start making about 1 million masks a month. General Motors, Ford, Tesla, here in the United States, all pledged their support to offer resources to make more ventilators, along with Japanese car maker Nissan and Formula One. Sorry about this. My teleprompter, again, is not working very well today. This is all about Telepath. If you would like to be tested, you can be tested on your phone, on your computer. It's very safe, very secure. These are for non-emergency diagnosis and prescriptions online from healthcare providers. And it takes about 10 minutes to do it for this virtual visit. Here, go to Cleveland Clinic Express Care online services and it allows you to choose between a demand visit right away and a scheduled virtual follow-up visit for a later date. Go on the internet and find that, but I signed up for it. It looks like a pretty good deal. I haven't used it yet. They charge you $55. It is covered by insurance. So I'm trying to keep this video as short as possible because I did one yesterday and it was like 18 minutes and that was way, 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 way too long, and I'm sorry about that. I always try to leave you with something a little bit inspirational. This comes from Benjamin Franklin. This is the second time I use Ben. An investment in knowledge pays the best interest. Think about that. Hey, Ron Crider here from Vero Beach, Florida at the Victoria Condominium. And I do these updates every day. If you like this video, give me a like. Subscribe to the channel if you would like to receive more of them. Remember, I don't make any money doing this. I don't charge anything for it. I'm not selling anything. I'm just doing this because I want to do my bit to try to help. Have a great day. See ya.